everyone, this is Callie Reed, board certified nurse anesthesiologist, and I'm here to educate you on what questions to ask from potential ketamine clinic that you're looking to receive a treatment. If you're watching this video, you may have knowledge about ketamine infusion therapy and what it's used for. I believe the outcome of your treatment is highly dependent on which clinic you choose, what protocol they're using, who's providing the infusion, what support they give you, and what pre-infusion preparation they recommend for you. We know certain medications that may interfere with ketamine therapy, so it's important that you do your due diligence on choosing where to go. Unfortunately, ketamine therapy is not covered by insurance for mental health disorder. So it's not a cheap therapy. It takes time, it takes commitment from you and your family. So let's start. Number one, choose a clinic that asks for referral from your psychiatrist or your primary medicine doctor. This process filters the seriousness of the clinic you're going to. It shows that the clinic wishes to treat a diagnosed condition by psychiatrist or a primary medicine doctor. You don't want to go to a clinic that have you come in on the same day as you call them. Before you start, you have to be empty stomach. You have to arrange transportation, and you have to arrange certain medications depending on what you're taking. So I would be concerned about any clinic that offers same-day treatment of your call. More importantly, when talking to your doctor about getting referral for ketamine therapy, we recommend asking yourself a few questions to help you figure out what you should discuss. It's normal to feel nervous when it comes to talking to your doctor about this new alternative treatment. So here are some questions to consider. How has your days been? Have you been feeling more down than usual? Are you feeling okay today, mentally and physically? When was your last full meal? Have you been drinking enough water? Are you drinking more than usual as far as alcohol intake? Do you have trouble sleeping now? Are you exercising? If so, is it the right kind of exercise? Answers to these questions will guide you to start a conversation. And of course, you want to mention that you are seeking alternative treatment to manage and relieve your symptoms. Number two, does the clinic provide integration coaching or some kind of coaching included as a part of the treatment? The real work and lifelong transformation is done in those conversations surrounding the infusion. Without coaching throughout the series, it can be challenging to decipher these messages you experience during your infusion. One of our goals for this treatment is to find the cause of your depression or a trigger. So it's so important to talk to your integration coach or your own therapist within 48 hours of your ketamine therapy. Number three, does the clinic offer 6 infusion series dose that's gradually going up to find the ideal dose? In my opinion, 2 to 4 infusion doesn't touch the surface. I've seen real work starts on 3rd or 4th infusion, so consider a clinic that are offering 1 to 2 infusions or just trying to get you in the door. Best practice protocol says 6 infusions. Double random research study all suggested that 6 infusion is the gold standard. So re-exposure of ketamine at cellular level creates the neurogenesis and neuroplasticity. And this has to be done within a certain time frame. So that's the key to the treatment. Number 4, I think this is one of the most important questions to ask. Who's providing your infusion? Medical doctor, physician assistant, psychiatrist, nurse practitioner, physician anesthesiologist, or board certified nurse anesthesiologist. The reason why it's so important to know who's giving you ketamine is that you want to have someone trained to give ketamine and handle the side effects, adverse reactions that can occur. So you want to have someone who knows what to do and when to do it. Ketamine is an anesthetic. Anesthesia providers use ketamine in operating room every day during surgery or diagnostic testing, and they are most qualified to give you ketamine. It can be either physician or nurse anesthesiologist. Number 5, choose a clinic that doesn't allow you to drive after your infusion. The clinic should be concerned for your safety, well-being, and takes extra precaution to make sure you are not placing yourself at risk. Number 6, choose a clinic that educates you on treatment plan to provide sustenance and maintenance plan. It's not always 6 infusion protocol and you're done. It involves you to do your own work, journaling, mindfulness practice, empowerment, changing your lifestyle, finding your passion, and separating yourself from your stressors in life. If you don't change your current life stressor, you tend to go back to where you started, and without your effort and commitment, ketamine infusion therapy may not be effective. 7. Choose a clinic that asks you to taper down certain medications so you get the best outcome from this treatment. We know that benzodiazepine works on GABA receptor, and when benzo is present, patients don't feel the psychedelic or meditative state during the infusion. This incredible meditative state or awake dream is where you do the most work by asking yourself important questions, connecting to your subconscious mind, and rediscover yourself. The psychedelic experience during the infusion is the vital part of the treatment. What that means is eyes closed with help of eye cover, not watching a video that's only to distract you. Also, during your infusion, you want to listen to the right music. Music makes the experience so much more meaningful and euphoric, if you will. All your senses will be heightened, hence your hearing. So, we also know that ketamine can make you feel nauseous, so coming in with full stomach will make you nauseated during or after your infusion. These are just a couple examples. There are quite a few things to consider before choosing the right clinic to start your treatment. And I hope I was able to help you by listing things that are important to consider for me. If you have questions, concerns, drop a comment. Please like and subscribe to our channel for future educational videos. And I hope you have a great day. See you next time. Thank you so much for watching. Bye.